Namaskara, I am Dr. Sunita Rana Agarwal from Dr. Agarwal Hospital's Bangalore. I am an ophthalmologist and I do genetic medicine. Eye exercises for pain relief are definitely very good. It should be done morning and evening. When you want to go fast on it, you do palming, wash your eyes, just do a little swinging, look at the distance and look at the near 20 feet away and then once again near, and practice blinking as much as you can. So you play with the ball, blink, 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 and then the figure of 8, do some eye rolling. But if you want to go against all of that, simple things to be done is just use some ointment on your fingertips and massage your lash margins morning and night. Along with that, keep some artificial tears on your table. Use it every 2 to 3 hours. Along with that, use some vitamins, good diet, good stress, sleep. Definitely an 8-hour sleep is recommended. 12 hours, just shut off because it takes you 2 hours to get to sleep. Make yourself a pattern that you can go to sleep with. All this and more brings you back to exercise. You must go out for a walk. How many steps you take is not important. Just walk around the block also, that's good enough. As long as you've taken the effort to do some exercise. With these, we are actually de-stressing ourselves as well. So the best way to do palming would be to fold your hands, make sure there's no light inside, and then take 20 breathings. What have we done? Isn't this one of the most important class that we take in meditation? Then that's it. So it's meditation as well. It's a lot of other things that it is reducing your eye pain and relief from there. A lot of our patients today are diabetics. A lot of them are hypertensives. That means anybody above the age of 40, we have more than 40% who are diabetic, more than 50% who are hypertensive. 20 years down the road and these are all progressive diseases. What do they have now? Now we are looking at diabetes with either insulin going up, then eye, brain, heart and kidney. 4 of these organs get affected in one way or the other. Through the eyes, we are able to make out diabetic retinopathy, hypertensive retinopathy. What is very important is to get a health checkup done every year. So you know you're not diabetic, you're not hypertensive. More than 50% of your problems you have already solved. When you are, then you need to keep sure that they are under check. Another very important problem in today's world and in our areas is age-related macular degeneration. A study was done in 1959 in Lassa, Tibet. At that time they found that there's so much of radiation from the sun produced age-related macular degeneration. So today we prescribe ultraviolet filtered light. That means we want to wear a sunglass when we go out in the sun. These are the reasons why age-related macular degeneration has increased, so much so that we have more than 12% of it in over 60 years of age. Definitely, the 20-20-20 rule is a simple thing. Every 20 minutes, look at an object 20 feet away for 20 seconds. This is very simple. Once again, keep an ointment, keep an eye drop on your table. That means you can put some eye drops even if you don't just put one eye drop in your eye every 2 hours. Most important is for you to check that you're able to see all the things with both your eyes. That means you're doing a simple check on your table. Look at the distance, look at the near and see your near vision, see any calendar or anything that you're used to seeing every day. Read that, and if you're able to read that with each eye, we're good to go. Diabetics and hypertensives have to be very careful because here the aging is going 5 times more than a normal individual. Eye exercises, like any other exercises, should be done every day. That means we are looking at every day in the morning, getting up, doing yoga, doing some exercise. Along with that, some eye exercises which are very simple and can be done in less than 5 minutes. Palming, washing your eyes, both your eyes, using the ointment on the lid margins, looking at the distance and the near, doing eye rolling, figure of 8. These are simple eye exercises. But along with that, when you finish everything, some tea bags, cold tea bags on your eye for about 2 minutes is good to go. They really work, and I can say that we have maybe gone on a fast track with this, where including the silicone plug, the diode laser treatment on the retina, injection, we take 1 drop of blood back as injections to the skin of the eye. Then we also like to go on multiple locations, because this is a subcutaneous module. It goes in through the lymphatics. This will go and repair it and thus bring back the mucus secretion, which is very much required by the eye. For diabetics, bring back the insulin, bring back all the cell receptors that had gone malfunctioning. So when we're looking at these little areas, we're looking also at anti-aging. We're also looking at immune response becoming better. So we are able to combat infections, combat allergies, combat diseases on a much better front